Okay, well, good evening, everybody. My name is Mike Crowley. I'm the CEO for the National Kidney Foundation of Wisconsin. I want to thank you for joining us this evening. I am new to the organization, been with National Kidney Foundation of Wisconsin for just about 7 weeks. We have an exciting evening to share with you. Dr. Elle Manawi is our featured guest speaker this evening. He is also a board member on the National Kidney Foundation Board of Directors, National Kidney Foundation of Wisconsin. So we'll go to the next slide. And what I'd like to do is introduce Sue Jelsund. She is our new Director of Community Outreach. She has joined us this evening, and she will oversee events, PR, marketing, and all things in a nonprofit world with the National Kidney Foundation of Wisconsin. So welcome, Sue. She's been with us for just over a week. And we'll go to the next slide. So a few housekeeping items I'd like to share with you this evening are during the meeting, the participants you'll see in the lower portion of your screen. You'll see first and last name displayed. If not, please use your rename your name that you had registered for the event. You'll see here during the meeting on the bottom is the participants. There's 22 participants in our meeting at this time. So as you're watching our presentation this evening and asking questions, you may have some questions for Dr. Elle Manawi. Participants should keep yourselves muted until you speak. So there is a mute button in Zoom. Make sure you click on that so we don't have any background noise. In the meeting, if you need to chat with us, have a question, we'll monitor in the chat section of the Zoom display. Feel free to ask questions and we'll do our best to get those answered for you. The video, using the video icon next to the microphone to start or stop your camera on your device. You're welcome to join us with video. We like to see your face since we're not live in person. But if you choose to turn the camera off, feel free to do so. We may choose to turn off the participants' video at any time during the meeting. And a little infomercial for you to help us with running our organization. When you join the Amazon, if you are Amazon shopper, we have Amazon Smile, and Amazon will make a donation to the National Kidney Foundation of Wisconsin every time that you shop with Amazon Smile. So type in smile.amazon.com, and that's how you can get into having them donate to us. Select the National Kidney Foundation of Wisconsin as your charity of choice. And we also have a Kidneys Car program, kidneycars.org. You'll learn more information there. Every donation, every dollar really helps our organization. And this program provides significant dollars for our nonprofit. So please visit kidneycars.org. And here's an exciting event coming up in the Milwaukee area. Kendra Scott, it's a jewelry, mid to upper end jewelry retail operation at the corners of Brookfield in Wisconsin. It's also an opportunity to shop online. They're going to donate 20% of your purchase to National Kidney Foundation of Wisconsin. So you can shop online if you're located anywhere else in Wisconsin or outside of Wisconsin. You just need to enter in giveback-136T on March 11th and 12th. We also will have coupons at the store. You'll need to present that coupon that has that code at the store when you make your purchase. So an exciting way to do some fundraising and have some fun also. Don't forget Mother's Day, Easter, or just because. And then thank you to CareDx for providing the Uber Eats vouchers. There is a $25 Uber Eats voucher that was sent to your email today. It's only good until 11:59 p.m. this evening. So if you have an Uber Eats app, you need to get it transferred to that and have dinner on us and CareDx. So thank you. With that, I would like to introduce Dr. Ashraf El-Manawi. He is going to present to us a topic that is very important to him. It's what I wish every patient would ask me. So as a doctor, he has lots of questions, and this is a topic that goes across all aspects of healthcare, not just kidney disease or diabetes, but all aspects of healthcare. So with that, I'd like to introduce Dr. Elle Manawi.
Thank you. Thank you for the kind introduction. And first, I'm going to reiterate that National Kidney Foundation is an important organization, not just for your own health, for the health of the society in total. So supporting it, you're paying it forward, if not for yourself, for your family members, for your neighbor, anybody else, because the effort that the Kidney Foundation does extend beyond a single person. So we'll have, and I am an old school physician who like to talk to patients, and I like them to talk to me, and I give them the chance so we can have an open discussion about their health and their wellness and disease. So since the topic living well before and after transplantation, before transplantation, to get to transplantation, you have to have kidney disease. People don't get to transplantation without having a kidney disease that causes kidney failure to start with. So we're gonna start with this process. Few questions that a lot of the time it comes to mind, but we're never asked these questions. Next. And we'll take this as we'll say how the kidney fails and what question that need to take place, what discussion with your kidney doctor, and back again from early kidney disease, what caused early kidney disease, and what would people, if they would know, they might improve their health. Then we'll talk about transplantation and some of the mistakes that people fall into after they get a kidney transplant. So the first question that I hope that everybody asks themselves, is kidney disease serious? Everybody think of the C word, which is cancer, and everybody's scared of cancer. Kidney disease can be as serious or more serious than cancer. Next slide. So it is serious to the extent that if it progresses, it will cause kidney failure. And your doctor will tell you, you need a dialysis or get a transplant to stay alive. And dialysis, people think of, because you see it on TV, oh, fine, I'm going to get dialysis. Or when Alonzo Mourning got their kidney failure, they came and said, we're going to give him a kidney, then going to be as good as new. Dialysis is not a simple process. It's a part-time job. And it doesn't replace a full working kidney. The function of the dialysis machine is way, way shorter than what the normal kidney would do. And it keeps patients alive, but their life expectancy is shorter, as I will show you. And it's also expensive, although it doesn't cost patient anything. It costs society in general a lot of money. So if we can save in one aspect, we can put it in different aspects of the society. And again, we say transplant, but transplant is not easy to come by, and kidneys are not available for everybody. There's a long wait list. We'd like to get people transplanted, but it's not always easily available. Next. So how bad kidney disease is. So if you look how many people, what percent of people who get kidney failure without getting a transplant, if you have 100 of them, what percent of them will be alive 5 years later? And you compare that to people who are diagnosed with cancer, what percent of them will be alive 5 years later? You'll find the only two cancers that are worse than the kidney are lung and pancreas, usually diagnosed late. Like, for example, if you have 100 dialysis patients without transplant, only about 40 of them will be alive 5 years later. But you'll find that diagnosis of breast cancer diagnosed early with things that we do now, 84%, 84 out of 100 can still be alive 5 years later. And you go on different colon, uterine cancer, melanoma, and oral cancer. The only cancer which is worse than kidney for 5 years survival is lung and pancreas. So it is a serious problem, and we try to avoid reaching that point by keeping the kidney working for a long time. Next. So people think, okay, is kidney disease common? Do I have risk for kidney disease? So it is common. If I tell you 1 in 10 Americans have chronic kidney disease, and a lot of them are not aware of this. So if you look at the United States, we're 330 million now, pushing 340. So there's at least 34 million people in the United States are living with chronic kidney disease now. So this is not a rare thing. If you have a family of 10 people, there's a chance that one of them has kidney disease. Some families have it more than the other. Next. And not only this, through time, we've seen the kidney disease is growing very fast. We're not going to go for the reasons why kidney disease is growing fast, but it's the fastest growing chronic disease in the United States. And if you look, I don't know if you see the slide very well. CKD is chronic kidney disease, the one on the far left on your screen, is in that a percent increase, 3.84%. Compare that to diabetes with only 1%. This is an over 2-year period. And depression come close second. And if you look at heart failure, which is far to the right, because our colleagues, the cardiologists, have been doing a really good job, congestive heart failure, during that follow-up period that we looked at, actually the incidence of it have dropped. And you'll find that chronic kidney disease actually is growing. There's so many factors that happening in the world that cause chronic kidney disease to go up, not simply because more people have diabetes, because we're seeing now different form of kidney disease that's not related to diabetes and hypertension, but we're not going to go through that today. So it's something that we need to be cognizant of, and we have to pay attention to it to try to identify it early and manage it if we have it. Next. So how about if my kidney is working, but it's not perfect? I'm still not needing dialysis. My kidney is still functioning. My doctor told me my kidney is still working. Will that affect how long I will live? And will that affect my health? And I'm going to show you a simple thing, which is mortality only. Next slide. So this is people age 50, 55, and 60, looking at people who have no kidney disease at all. People have kidney function less than 60%, which is the yellowish bars, and kidney who has kidney that's leaking protein or proteinuria. And people have both problems. And if you look at any of these age groups, if you have these two problems, people will shave 10 years off their life expectancy, meaning that they usually die 10 years sooner than people who don't have kidney disease. So although the kidney is working at 50%, and people are still not aware that they have kidney disease sometimes, that the kidney is 55%, and in the same time put them at risk for cardiovascular death, and they die sooner. And death, by the way, is one of the things that not quantify, it's not quantitative, meaning there's no difference between somebody who's dead or somebody who's very dead. So when people are dead, but there's health status that goes with this shaving of life expectancy. People's health become worse. So their heart will get down faster, their energy level will go down faster. So it's really important to keep kidney function as close to normal as possible and avoid progressive kidney disease. Next. So people always tell you, and this is a confusion, honestly, people, well, I make enough urine. can I still have kidney disease? Some people, I don't have kidney problem. I'm peeing enough. So to look at it, and this number sometimes be sobering for some people, a normal kidney will filter around 180 liters of fluid from the blood throughout the day. It takes it in and brings it back. 180 liters, which is like almost 54 gallons every day. But normal people don't urinate 54 gallons. They pee less than half a gallon a day, which is around 1.5 liters. This is on average, some people more, some people less. So you can actually, people have a drop in the kidney function to 10% or less. They still filter around 14 liters of blood. And with these 14 liters of blood, they can still make the same 1.5 liters of urine. And if you look this way, the amount of urine that we make sometimes does not show us how well the kidney is working. Of course, if somebody stopped urinating completely, the kidney is not working, but people can make good amount of urine without knowing. And this is a myth that a lot of people don't seek to examine or see if they have any kidney problem, because they feel, I'm peeing, well, I don't have any problem with peeing. Isn't the kidney, all what it does, it make urine? No, urine is the product or the byproduct exhaust that the kidney produce. It's like the function of the kidney is different from the exhaust. It's like if you're driving a car, there's exhaust coming out of the muffler, but not the function of the engine is to make exhaust. The function of engine is to do other work that makes the car move and take it from a place to place. So exhaust is just an exhaust, urine is just an exhaust. The kidney does way much more than producing urine, and the amount of urine will tell us, okay, how much we're putting out. Next. So what is the causes of kidney disease? And people, okay, now we got my attention. What can give me kidney disease? Well, this is looking at people who reach dialysis. The most common cause of dialysis or kidney disease is diabetes. So diabetes and everything that leads to diabetes, we're not going to go through the causes. So it's really important for people from very young age to start to pay attention. What will put me at risk for diabetes? And if I have diabetes, I have to control it. And the next most common cause for kidney disease is high blood pressure, hypertension, which is the red part of the pie. The diabetes is the blue part of the pie, and the red is the high blood pressure. Then you have other causes, which is smaller, like inflammation in the kidney that can happen and can be managed. Some cystic disease, like polycystic kidney, people are inherited, some inherited disorders, and other causes are combined in one part of the pie. So if we want to focus on these things, the two main things are diabetes and hypertension. And between these two, it's close to 70% or 60% of people who have kidney disease will be to the diabetes and hypertension. Next. So in kidney disease, if you remember, people tell you hypertension is a silent killer, but it's not a silent kidney disease. Most kidney diseases are even more silent than hypertension. So the kidney itself, the kidney as a tissue does not sense pain. So even if you have kidney inflammation inside the kidney from anything or any problem, there's no pain. Stones is one of the few things in the kidney that cause pain, but it's not the kidney tissue itself that sends the pain. It's usually the tubes that collect the urine down is the one that sends the pain. If you have an inflammation outside the kidney, the casing of the kidney also can sense pain, but kidney don't sense pain. And people will feel exactly the same as the kidney function decline. The fact is, most of people are not going to have any symptoms of kidney failure or kidney problem till the kidney comes close to 10%. And at that point, they're coming very close to what we call end-stage kidney disease, meaning the kidney is almost gone and there's not going to be enough function soon to sustain life. And how can I tell if I have kidney problem? And that's the question that always comes. In the hospital, we tell people that there's a specific time in the hospital we diagnose kidney failure in all patients, which is when the labs come back in the morning. So the reality that kidney disease is only a lab diagnosis. We rarely can diagnose kidney disease in most people without blood and urine test. And this is an easy screen. Primary care can do it. They can do it once a year. The urine test is very simple, very cheap test, and it can show us few things that are a problem with the kidney. And talking to your primary care, especially if you know that you have few of these risk factors, you need to talk to your primary care, or even see a physician. And I know that a lot of young people, life is very busy. They're working really hard. They have their own life to take care of. I've seen people have not seen a physician for 15 or 20 years because they don't feel anything. They're okay. Oh, if they get hurt, they bend their wrist, they have an injury, they run to urgent care and they address the problem. But seeing your primary care physician in a regular visits, at least once a year, once every 2 years, and they run tests, will allow them to identify a kidney problem. And if you have family history of kidney disease, you need to talk to somebody about it because there's a good chance that you inherited something that might put you at risk for kidney disease. Next. So, and all people always say, yeah, I know I have a diabetes and it is a problem and I'll take care of this later. I'm busy now. I have a family to take care of. I have a business to do. I'll pay more attention to diabetes because I'm still feeling okay. Yeah, my blood sugar is a little bit up, but I can do that. The problem with the diabetes, it's like termites. It eats on the body and the kidney very slow without people feeling how it is. So if you ignore a termite problem in your house, when the house collapses, it's too late now to treat the termites. You need to build a house again, or a tree, not necessarily a house. So these things that eat slowly on the body need to address it early. It's like if you haven't, going back to the car, if you're not hearing any noise in the engine and your car has like 30,000 miles without an oil change, by the time you see a problem, it's too late to save that engine. Regular maintenance of the body is really needed. And diabetes is a problem that need to be addressed and need to be controlled. People can fight flu or a cold, but they cannot fight diabetes. People who fight their diabetes actually destroys them and end up eating on them very gradually. I see a chat came up. I did not catch it. I don't know if that was a quick question or somebody logging in and out. So we can go to the next slide. So people inherit a lot of things from their parents and say, my parents have high blood pressure and never saw a doctor and they lived well in their long time. Well, we're not our parents. Yes, we have things like them, but everybody is different. And if they have high blood pressure and survived it, it's a matter of luck. If somebody crosses a highway in the middle of traffic and doesn't get hit by a car, doesn't mean everybody else should continue to do it, get lucky. So high blood pressure is one of the things that we need to address and not ignore it. And it's not only that will lead to kidney problems, lead also to heart problems and other devastating health issues that can actually cripple or decommission the person. So if anybody has high blood pressure, they need to make sure it's well controlled and not ignore it for a long time, because high blood pressure within range, people don't feel anything. And usually blood pressure goes up gradually. So people get used to it and don't know what is happening till something bad happens or their kidney fails. Next. So, and this is something that I hope people ask. They ask the doctor, they ask kidney specialist, how can I reduce my risk for kidney failure? And the first step is maintain your body. And the two main reasons for the kidney failure is diabetes and hypertension. Make sure if you're not diabetic, that you don't push yourself in that direction to become diabetic. And we know the risk, eating a lot of carbohydrate, not a healthy lifestyle, lack of exercise. There's a lot of things can push it, increased weight, push us towards diabetes. And if you have high blood pressure, control blood pressure. Don't take medications, even over-the-counter medications, without supervision of a physician. Over-the-counter medication, some of it could be toxic to the kidney. And people with kidney problem, they're not going to know that I'm taking something toxic. Herbal medications can have things that are really bad for you. And people need to know that most of the herbs and the supplements that they have, it's not regulated as much as medications. So it can have a lot of ingredients in it that really toxic to your kidney. Years ago, in the 2000, there was like a huge number of people developed kidney failure after taking supplement that helped them with weight loss. And what happened that the supplement that we used to call it Chinese herb nephropathy, which is kidney disease related to Chinese herbs. And the problem that one of the producers who brought that stuff from the Far East used a different tuber, which looks like the right one, but it has a toxic chemical in it. And toxic chemical produce permanent kidney damage, and there's no going back from it. So supplements, use them with caution, consult your own doctor or healthcare provider to help you if you're not sure about what you're taking. Same thing, don't overdo anything else that will cause your kidney at risk. The one that we know is excessive use of pain medication over the counter, like non-steroidal anti-inflammatory Motrin and company. Small amount of it is usually okay, but people who abuse this medication can become a problem. Mixing medication, people who end up going to multiple physicians in different areas, and this physician doesn't know what this physician is prescribing. Mixing medication sometimes could be damaging to the kidney. So we have to pay attention to our health and keep it this way. Next. So, and when people have kidney problem, sometimes they don't want to keep seeing physicians. And they always say, and I hear that from some physician actually, do I need to send you this patient to see? Let the kidney specialist decide, do I need to see you on a regular basis or not? And your primary care doctor, think of it as the quarterback who runs the team. He cannot be the running back and the wide receiver in the same time. Yes, some quarterbacks, I know they do run the ball, but they should not do that if you want the team to win. So the primary care doctor, although they know a lot, they'll be able to identify if you have issues with kidney or not. You need to see a kidney doctor and let the kidney doctor decide, do you need a kidney specialist or not? Because there's some pieces of knowledge in medicine is changing all the time, and new things are being discovered, and a specialist will be always able to test for few things that not other people will be able to think of it all the time. Next. So, and people tell, okay, now I have kidney disease. When did that start? So that's a question is very difficult to answer, but to surprise of a lot of people, sometimes it starts at birth. So if the kidney is not built well, it's like something, if you want something to last, a machine, for example, it's how it's built and how it's maintained. If it's well built and well maintained, it will last long. If it's not built well, meaning that something happened when mom was pregnant with the baby and the kidney did not develop as well, be it exposure to chemicals, exposure, we know now exposure to alcohol, even a single alcoholic beverage during pregnancy, exposure to tobacco smoke, either first or secondhand tobacco smoke, chemicals at work, poor dietary habits during pregnancy can actually put the baby kidney disease risk when they're 40 and 50 later on. Premature birth, we know, put people at risk for kidney disease. So might have started a long time ago. And that's why even if you're healthy when you're young, it's always good to get regular health checks. And the National Kidney Foundation, people worry about their kidney, have regular clinics or regular events that we actually try to help people discuss the risk for kidney disease. And some people say, okay, I have kidney problem now, and I have children and grandchildren. Are they at risk for kidney disease too? And what should I do with that? Some diseases or some risk are genetic. People will have a certain gene that we know a number of them put people at risk for kidney disease. And one of them, they have a common exposure to chemicals. And we have to look at the cause of the kidney disease and decide, as your family members, children and grandchildren are at risk. I'll give you an example of the genes like polycystic kidney. Polycystic kidney, what's called autosomal dominant, is a flip of a coin. Either the child will get it or not, because 50%, if it's the odds are exactly distributed, 50% of the children, if somebody has polycystic kidney, will have polycystic kidney. So it's one of these things are this way. Some of them are even less than that. That's the genetics. Exposure is something else. We inherit from our parents few things, although we inherit their genes, but frequently also we inherit their diet habits. and they have unhealthy diet habits, we end up following the unhealthy diet habits from a very young age that puts us at risk for kidney disease and high blood pressure or diabetes later on. Can we get the next? So, and we get down the line and patient will say, well, my doctor told me I will be needing dialysis soon. I don't want to think about it because if I don't think about it, it will go away. Yeah, these are the problems that doesn't go away if we don't think about them. And what should everybody do if somebody tells them they need dialysis? Not to ignore the problem. It's always good to go to dialysis prepared and not to go to dialysis unprepared, because there are options there. And on top of it, if you're following up with your doctor, and once the kidney drops below a certain percentage, your doctor can get you on the transplant list. And being on the transplant list, the weight on the list varies from a center to center and from city to city. But you take your place in line from two spots, listing, and we can list people when they drop below 20%. Let me tell you, in my clinic, I have people on that transplant list for 9 years and they're not on dialysis yet. So that put them at the top of the line by the time they're needing dialysis. Or your spot on the line comes the day you start dialysis if you did nothing on it before. And on top of it, preparing for dialysis, which requires a lot of workup, will keep you safer on dialysis if you have to get to dialysis. So talk to your doctor, don't ignore it. And the closer you get to dialysis, the higher the risk of dying from small things that can kill you suddenly. So seeing your kidney doctor when you're coming close to dialysis on a regular basis can save your life and allow you to live longer. Next. And when people say, well, I'll be starting dialysis here, so what is my next step? What should I do? I know I don't like what is happening. What should I do? I said earlier, dialysis is a part-time job. The pay is well, because the pay is staying alive. But as any other job, there's always incentive and bonus that comes with doing the job well. And the incentive and bonus with doing the job well in dialysis is you stay healthy and you reach that bridge to transplant, reach transplant in a good health. And how to do the dialysis job well is to go to dialysis all the time. I tell my patient, the only reason that you don't show up for your dialysis if you're in the hospital emergency room for something else, not just because you're not feeling. If you're not feeling well, you come. And take all the medication. It's a different lifestyle. It's a different process, but there's no other way around it except to follow and do the things that need to be done. And if you do a dialysis job well and get yourself on a transplant list, you might come off dialysis sooner or later. Some people get discouraged by knowing that the transplant wait in their city is very long. There's always a chance, yes, it's not very high chance, that a kidney comes that matches you that nobody else is a match for, and you hop the line. And also, if you have a living donors, try to find a living donor, because living donors, there's no wait here. And even if somebody is willing to donate and they might not be a match, we have a way, and we talk that in the different programs, that how people can go on a matched list that you can actually exchange kidneys. So do your dialysis well, stay with the program, and you stay good. Next. Then you're one of the people who did everything right, got to transplant, and you get your transplant. And this is the sad part, and I've seen this happen so many times, and honestly, it's heartbreaking that people feel I got transplant, now I need to pay attention to anything. I can live my life the way I want. And can I just relax now and do nothing? This is correct? This is absolutely wrong. And when people relax, when you have a transplant, sometimes that kidney gets rejected or the kidney fails. And it is sad when somebody gets this precious gift, which is a transplant, and they end up actually losing that transplant because they're unable to do it. And sometimes, yes, the reasons are beyond their control, meaning that they lost their insurance, they cannot pay for medication. But I want to tell everybody who's listening, and they can pass it to everybody that they know, if you get a transplant and you're unable to pay for your medication, that transplant center will go out of their way to make sure that you get your medication, and they'll do everything in their power to make sure you get your medication. So don't think because you're unable to get your medication, you should stop. If you call transplant center, they'll take care of you. They'll do their best to make sure that you get transplant. They know how precious transplant is, and they can continue to support you through the process. The goal of any transplant center to have the kidney last as long as possible. And of course, it outlasts the person who got the transplant. Great, 30 years longer, that would be great. So get transplant. You cannot stay away from your transplant doctor. You need to continue to follow up with the transplant. Next. So, and some people say, I miss few days of transplant medication. Is this a big deal? Right? No, it is a big deal, because the immune system is the sleeping giant. And if you allow the sleeping giant to wake up and start to activate against your transplanted kidney, sometimes you cannot put it back to sleep easy, and requires a lot of work to have the immune system done. And during that process, the immune system is going up. It might damage the kidney a little bit. Yes, might not lose it completely, but you take out a bite out of it that reduce the lifespan of that transplanted kidney and make it last a shorter time. So try not to miss transplant medication. And if you're running out of medication and you feel that I need some, again, call the transplant center. If you're traveling and you forgot your medication at home, life happens. The minute you realize this one, you call the transplant center, they'll figure out a way that you get your medication wherever you are. Next. So I think I put these questions and I said, okay, if anybody has any question, we'll free. I'm here to answer any question that any of the audience have.
Not seeing any questions yet.
We'll
Anybody have any questions? Feel free to turn off your microphone. Oh, here we go, from Gary Shea. What does A1C measure?
So A1C is a hemoglobin in the blood that has glucose attached to it. So it measures how high your glucose on average in the last 90 days. So why we say 90 days? Because when the body makes a red cell, only lives 90 days. And after the 90 days, that's on average. It breaks down and the hemoglobin in it gets released and get recycled in the body. So as the glucose stays high, it keeps adding glucose to the hemoglobin. And that's what we call it, hemoglobin A1C. So it's an average measurement of how high the glucose over the past 3 months. So your people who have diabetes, they know sometimes my blood sugar is 300, but sometimes it's 60. But what is the average? If the average is higher, the higher the average, the higher the A1C, which tell you that your body is exposed to a higher blood sugar on average in the past 90 days. So it's more a reflection of how well you're controlling diabetes than a single measurement that we take.
And then the next question is, please address the effects of power drinks on the kidneys.
It depends what power drinks. So power drinks has a lot of bad chemicals in them, that some of them are partially kidney toxic. One power drink is not going to take the kidney down, but it can actually damage the kidney slow. And more important than this, power drinks, frequently, most of them will raise the blood pressure. And the higher blood pressure on the kidney, think of it as the RPM on an engine. The more you rev that engine, the less life you're going to have on it, and you're going to lose engine life. So it's not a good idea to have power drinks. A good night's sleep, cup of coffee without being too excessive will be sufficient for people to function. And if you're unable to function without a power drink, you might have a problem that will actually make your kidney fail fast. This is a bit off topic, but people with sleep apnea, which is not a rare condition, frequently they're tired all the time, and they need a stimulant to keep their brain going. And sleep apnea is one of the things that can actually damage the kidney slowly and also damage the heart slowly. So if you feel the need to function, that I need power drinks, talk to your doctor and they'll see, why am I fatigued all the time to the extent I need power drink?
Thank you. And the next question is, I believe both smoking and drinking alcohol is bad for the kidney. What about being around people that smoke marijuana daily? Is that bad as well?
So that's a tough one, because there's some mild damage to the kidney from marijuana because it affects the way the metabolism in the kidney takes place. And it will also affect the rest of the body. It's not just the kidney, because marijuana affects the nervous system, affects the nerves that control blood pressure. It affects the appetite, affects different things. And it depends what kind of, they put it, is a joint, I don't know what they do, they smoke it in, is it in a one of these bubbly things, or is it stuck inside a cigarette? So I don't know honestly what form of smoked marijuana is. Data is not very clear. There's so many research need to be done, and the slow research with marijuana, because marijuana is still federally prohibited. And most of the research that we do in the United States is funded by the federal government. So you cannot actually get any federal funds to fund marijuana research. It's not easy. And that's why we're lagging behind in understanding of marijuana. And without proper controlled research, answers are always vague and always biased, depending who's given it to you.
Thank you. Next question is, I was transplanted on 1/20/21. How much protection will I have with the COVID vaccine?
Protection from the COVID?
Yes, with the vaccine.
So the short answer, there's no data. We don't know, because the COVID vaccine has acquired, everybody knows, what's called emergency use authorization to protect the populations of the world from this virus that's devastating the world. So we didn't have transplanted people in these studies. With that said, from the history that we know of other vaccines, if it's just a vaccine like any other vaccine, we vaccinate transplant people. Sometimes the response is not as strong, but we vaccinate them, and frequently it's successful, because you get your flu vaccine every year. And if you don't get it, you might be at risk for getting the flu. It's not any different from this. But to give you an affirmative action, we don't know the answer to this.
Thank you. I don't see any more questions. We'll take a few more questions if you have them. We have a few minutes to spare here. And in the meantime, I'll do a spare your share clip. If you have a spare kidney, feel free to look into donating that as a living donor.
So since we're still on the line, people always worry about giving a kidney. It is relatively safe. It's a simple surgery. And the transplant centers in general, they really care about the donors. So they investigate the donor risk for having a kidney problem later on if you donate a kidney. So if somebody is willing to give a kidney to a loved one, or some people want to do it without anything. I have somebody that I know, he decided, I feel I need to do something good in my life, and went to donate a kidney. I have actually 2 people that I know personally have called me to say, am I okay to donate a kidney, because I feel that I'm in my 50s and I feel I want to do something good for somebody else. I don't have anybody that I know have kidney problem, but I'd like to donate one of my kidneys if I can. Transplant center will make sure that you stay healthy. And even if you things happen in life, accidents happen. And if somebody donates a kidney and something happened to them which is unexpected, which could have actually taken both kidneys down, They immediately at the top of the transplant list. If their kidney fails from any reason, they get in a bad car accident, they bleed, or they have an injury to their kidney, they get an infection that affects the kidney function and take it down. And this could have taken both kidneys down, by the way, these accidents. But since they have donated their kidney, they immediately become at the top of transplant list. So if you have a spare and you're willing to give it away.
Thank you. We have two more questions. We'll close with these two last questions. The first is, what would you consider an easy way to save our kidneys that most would not think of?
The easiest way is stay healthy. I'm going to quote the Volvo commercial. I tried to find it when I was looking for this. It was like, I think in the late 90s or early 2000s. And they have a car that said the Volvo is very safe in accidents. And they showed a car going against the wall and it stopped short of the wall. And it said the safest way to be safe in an accident is never to get into one. So that's the safest way to save the kidney is never to have kidney disease. So healthy lifestyle is number one. We have kidney cash, don't spend it. Because when we're born, by the way, with very few organs, we don't regenerate our organs. We spend our organs through life. It's like I spend good part of my hair through life, spend different things. It happens. And don't spend your kidney cash fast. And if you save it, it will last you long.
Thank you. At what percent kidney function should you start dialysis?
So this is people will start feeling symptoms around the 10%, but starting dialysis is never with a percent because everybody's different. And that was looked at, by the way, in Australia and New Zealand a while ago, like more than 10 years ago. And they did it countrywide in these two countries. And they looked, is starting dialysis early beneficial? And the answer is absolutely not. The starting dialysis before you need to. So we start dialysis usually based on symptom and based on things that put your life at risk. Some people are unable to control their blood pressure or fluids. Some people are unable to control their potassium. But by number, which is actually, it happens in different parts of the country. I'm not blaming anybody, but sometimes the physician becomes so scared that at that level of kidney function, their patient might be at risk of losing their life. So they start them dialysis. But no, there's no number. But people will start feeling symptoms around 10%. I can name 4 patients or 5 patients in my practice that are at 6% for more than 5 years. And they're fine. Yeah, if they have a lot of symptoms, but they don't need dialysis. Kidney is better than dialysis. And the best dialysis that we give to anybody, by the way, in a dialysis center is about 8 to 12% kidney function. So people think I'm getting dialysis, I'm going to 40% kidney function. No, the best dialysis that we have will probably reach 12% kidney function. So if your kidney is working and able to function with it, you're perfectly fine with that.
Good. We have 2 more that are, I think, very relevant to what we've been talking about on kidney donation. And I'd like to get these 2 questions answered and then we'll close. Does age difference matter in kidney donation for the receiver?
Age difference, meaning that the donor is younger or older?
Correct.
So here's one thing I tell you, and everybody who's listening, I'm a car guy. People from my age generation, we all worked on cars when we were young. So we're all car guys. So would you rather get a Mercedes with 70,000 miles on it or get a Yogo brand new? So it all depends what you're getting. So some people, honestly, regardless of their age, the kidneys are pristine. So the age difference doesn't make a huge thing. The worry would be if somebody who's really young and they're at risk for developing kidney disease later on, we take a kidney from somebody 21, and we know they have risk for kidney disease, that they have a strong family history of diabetes or high blood pressure, and the blood pressure still. And that's the risk for the donor. For the recipient, it depends what you're getting. If you're getting a good kidney, it doesn't matter when it was made.
And then lastly, very useful information regarding kidney donation. Many are leery of donating a kidney as this will leave them with only one existing kidney. Dr. El-Meanawy, can you address that on the emotional side and the realistic side of living with just one kidney after they donate?
So let me start with the emotional side, which is true, by the way. For some reason, people who donate a kidney and wanting to donate a kidney, not pressure into donating a kidney, their actually health improves. And we found that the feeling that they have done something noble actually improves their health later on. So emotionally, they're better after they donate a kidney. And living with one kidney, and they might come to surprise some people, 1 in 4,000 people are born with one kidney. And they have no idea that they're born with one kidney. They live and die with that one kidney. We're born usually, if the kidney is built well during pregnancy, we have enough reserve in it. It's like, I'll give you a car with 12 cylinders. If you lose 6 of them, you still have 6 cylinders left. So we have a lot of kidney reserve. People will function perfectly fine with one kidney, and they're gonna live as long it's okay. And who decide that? The transplant center is really one of their biggest priority in living kidney donation, is to make sure that the donors are healthy to donate and they will be okay after this, and they follow. The only thing that is really deficient now, that people will donate and disappear. After 2 years, they disappear on the center and they don't come back. Continue to follow with your primary, continue to follow with somebody after you donate a kidney. That's how you stay safe. It is safe to donate a kidney. We have enough data coming out there. Dr. Mari from Johns Hopkins is doing a lot of research looking at data for a lot of people who have donated to see what will happen, how long the kidney would last. And there's more and more stuff coming down the line. Believe it, all of us are really focused on protecting the donors, not to make sure that we take a kidney out of them.
Thank you, Doctor. So we have a few more questions. Maybe we'll be able to try to reply to those via after the show is over. We are running short on time. We do have some more slides to follow. So thank you very much for answering all those questions. And thank you those participants for asking questions. And we really appreciate the extra time that Dr. El-Meanawy had spent asking or answering the questions that our audience had asked. We could probably talk for another hour about this without any issues, and but we do have more to finish up on. So with that, thank you, Dr. El-Meanawy. It was very informative. I'm a sponge, as we all are, trying to learn as much as we can. It was a fantastic presentation in layman's terms, learning from you, and we look forward to future events where we can hear more about kidney disease from you. And once again, thank you.
You are welcome. Thank you for having me. And if I can ask you, just compile these questions and send them to me, and I'll answer them and send them back.
Wonderful.
So we can send them to the person who's asking.
Very good. We can do that.
Thank you.
Thank you once again.
You have a good day.
So, you too. So we have a program evaluation survey. We'd like to know what you thought of tonight's program. Complete the Living Well Before and After Transplant survey and share your opinion. And there is a surveymonkey.com /r/LW03-09-21. So we would appreciate hearing from you. We do have upcoming programs on Thursday, March 11th. We have chronic kidney disease, what you need to know. That is put on by Frater in the Medical College of Wisconsin, a great partner with the National Kidney Foundation of Wisconsin. And on Tuesday, March 16th, Living Donation and Communities of Color, Living Donors Together. Another fantastic event. That one I participated in last month, and I just had a great time talking with living donors from around the state. Very interesting. Next slide. We have our upcoming event, the Capital City 5K Run and Walk on Saturday, July 31st. Most likely that will be a virtual event again, as it was last year. It was very successful. Look forward to more information from us regarding that event, but please save the date. And tonight's PowerPoint presentation, the presentation itself, there is going to be a recording of this PowerPoint slideshow at that website. And that will conclude our presentation this evening, A Physician's Confession. What I wish every patient would ask me. Thank you again for being a part of our program.